Hello, my name is Harshini.
Hi, I'm Shen.
Hi, my name is Udaya.
Hi, I'm Cynthia.
Hi, I'm Lutna.
Hi, my name is Hafiz.
Hello, my name is Amir Firdaus.
Ya Allah, aku pasrahkan diriku sepenuhnya pada saat ini.
The consequences of a hip injury resulting from an accident can vary based on the specific circumstance and the extent of the trauma. In milder incident, the hip might sustain contusions or bruises causing discomfort, swelling, and discoloration. These injuries typically affect soft tissues such as muscles and blood vessels. In most severe accidents, fracture can occur in various parts of hip bone, such as the femoral neck, femoral head, or occipital. Treatment approaches depend on the type and location of the fractures and may involve casting surgery or combination of both.
In order to achieve rapid mobilization and complete weight bearing, hip fracture are treated with prosthetics or different types of fracture fixation devices. Osteoporotic bone, bone vascularity, muscle attachments, fracture reduction, slow fracture healing, and the frequently elderly population are challenges. Although the number of patients requiring a reoperation has decreased recently, 5 to 20% still do, primarily depending on the type of fracture and surgical approach chosen. Treatment options for hip fractures mostly fall into two categories: prosthesis and osteosynthesis. In order to replace the femoral head with a prosthesis, the fracture site must be cleaned and either a partial or total hip arthroplasty, the latter of which also includes an acetabular cup, must be performed. In an osteosynthesis, bone fragments are reduced to a suitable place and held there until they heal, commonly using intramedullary nails, sliding hip screws, or parallel implants. While osteosynthesis is always carried out through multiple lateral methods, with the patient supine on a traction table and the use of a radiographic image intensifier, prostheses are also installed with the patient either lateral or supine depending on the surgical approach.
What is the type of hip bone implant? Medical advancement offer the first hip replacement option with factors like patient age, activity level, surgeon prefer, and hip deformation guiding implant selection. Explore available type for a personality choice. The first type is common metal and plastic implant. Titanium or stainless steel metal are commonly used. Implant include a metal board and socket with a plastic spacer in between. Implant are executed either by pressing or clamping into place or by using a special bond cement. The second type is metal on metal implant. Similar metal component as in common implant, no plastic spacer are used. Rather improved but highly resistant to wear and tear. The last type is ceramic implant. Ceramic material used inclusive in the board and socket. Metal are used in the bond, now for bearing wear resistance, scratch resistant and small.
The next slide that I'm going to present is the proof of the hip bone implants. First of all, the first proof of the hip bone implant is stability and support. They can provide stability to the hip joints, preventing further damage and promoting overall joint health. Second is improved mobility. They can restore movement and functionality, allowing for better mobility and flexibility. Third is pain relief. Implants can alleviate chronic hip pains caused by injury, arthritis, or other conditions. Last but not least is long-term solutions. Successful hip bone implants can provide a long-term solutions, reducing the needs for the frequent interventions.
So for the con of hip bone is surgical risk. Blood clots. Following treatment, blood clot may form, which could lead to more serious problem. Not very long lasting wear and tear. Wearing out of the fake part can happen over time, especially in people who are very active. Reaction to allergen and inflammation. Metal allergies. Some people may be allergic to the metal used in the implant, which could cause swelling and pain. Leg length different, alignment problem. Getting perfect equality in leg length during surgery is hard to do, and there might be a small difference. Nerve and blood vessel damage, nerve injury and vascular damage. By nerves can be accidentally hurt during surgery, leaving the affected leg numb or weak. Bleeding or problem with blood flow.
Hello, I'm Harshini, and today I'll be talking about the limiting factors or risk of hip bone implant. So first, we will talk about limiting factors. Obesity poses a risk to hip replacement success by increasing stress on the joint and implant. Infection, a general surgical concern, can be particularly challenging post-hip replacement, often necessitating additional surgeries. For example, like metal on metal MON implants carry the potential threat of releasing ions to the bloodstream, causing adverse reaction and tissue damages. Besides that, revision surgeries needed if the implant fails, and which is this more intricate and have higher complication risk. Meanwhile, as for risk, there's infection and blood clot formation at the surgical site, which is common for post-operative risk, as is the dislocation of artificial hip components over time. There's a risk of implant component loosening and potentially requiring further surgery.
The conclusion on why hip bone implant is a good choice are: first, it can reduce pain and improve mobility. Patients with severe hip injuries can benefit greatly from total hip replacements that involve implants in terms of pain relief and improved mobility. Next is lasting solution. Modern hip implants are made from durable materials that can last from 15 to 20 years or longer before needing to be replaced. After that is bone preservation. Many modern hip implant techniques aim to preserve as much of the natural bone as possible. Also, hip bone implant can make the recovery quicker. Advances in surgical techniques and implants materials now allow many patients to recover mobility within just a few months following total hip replacement surgery. And lastly is to restore active lifestyle. For previously active patients with hip arthritis or injury, a well-placed hip implant can help restore the ability to participate in many sports and activities.